Welcome to Chains Unbroken. I am Gobugbuji. How much is a life worth in Ghana? Do our leaders truly care about the health of the people they govern? Why is it that when we fall ill, our survival depends not on our will to fight, but on the size of our wallets? Today, we confront an uncomfortable truth. Ghana's healthcare system is failing the ordinary citizen. Chronic diseases like kidney failure and hepatitis are on the rise, but access to treatment is a luxury only the wealthy can afford. Dialysis centers are scarce, treatments are expensive, and too many Ghanaians are dying, not because their conditions are untreatable, but because their lives simply aren't a priority. Every day, chronic diseases claim the lives of ordinary Ghanaians. Kidney disease, once rare, is now rampant. Chronic kidney disease, CKD, in Ghana is 13.3% of the population. In Ghana, hepatitis B affects 15% of the population, and treatment costs range from 2,000 Ghana cedis to 10,000 Ghana cedis, completely out of reach for most. Yet, our national health insurance scheme barely covers these expenses. Where is the safety net for the people who carry this nation? Yet for most people, these conditions are a death sentence, not because they are untreatable, but because they are unaffordable. Dialysis costs 380 Ghana cedis per session minimum. That's over 4,500 Ghana cedis a month, and it doesn't include medication. For hepatitis, antiviral treatments can run into thousands, and for transplants, forget it. Few Ghanaians can dream of raising the $20,000 required. Can one be diagnosed of kidney failure in Bimbilla Municipal Hospital? Can one undergo dialysis from the same facility? Many die out of this condition because we lack diagnostic machines for early detection in our hospitals in Ghana. Even when diagnosed, dialysis centers are far from reach. If this were a priority for our government, dialysis centers would be as common as district hospitals. In 2023, a young girl from Accra captured the nation's attention. At just 13 years old, she was diagnosed with kidney disease. Her parents, both petty traders, couldn't afford the cost of dialysis. She missed school, her dreams of becoming a nurse shattered by the weight of a disease she didn't choose. Her story aired on national TV, bringing many to tears. But what changed? She's not alone. In Kumasi, a man sold his only taxi to fund his wife's treatment. When the money ran out, so did her life. In Tamale, a woman with hepatitis couldn't afford antiviral treatment. She died, leaving behind 3 children and a husband who blames himself for not having enough. Ghana, how many more must we bury before we act? When politicians fall ill, they don't stay here. They flee with first-class flights to the USA, the UK or India, sparing no expense. They use the taxes of ordinary Ghanaians to save themselves while neglecting the very hospitals they built for us. In 2022 alone, Ghana spent millions of Ghana cedis on medical evacuations for politicians. Meanwhile, our hospitals lack dialysis machines, and hepatitis patients are turned away because there's no medication. Ask yourself, what makes their lives more valuable than yours? Why should the rich survive while the poor perish? Leadership is not about escaping the problems, it's about solving them. Ghana, are our leaders truly leading us, or are they just saving themselves? The rise in chronic diseases is not accidental. Illegal mining or galamsey has poisoned our rivers with mercury and other deadly chemicals. Communities that once thrived on clean water now drink from polluted streams. Mercury exposure is a leading cause of kidney failure and liver damage. Yet, despite the outcry, galamsey continues. Why? Because those in power benefit from it. Our leaders value wealth over health, profits over people. The same water that poisons us is used to fund their lavish lifestyles. Ghana, how long will we allow this to continue? How long will we suffer in silence while they thrive on our pain? It doesn't have to be this way. Rwanda provides free treatment for hepatitis. Botswana offers subsidized dialysis for all citizens. Ghana, with its wealth of resources, can do the same. If we can fund luxury vehicles for government officials, why can't we fund dialysis machines in every region? If we can spend billions on failed projects, why can't we subsidize life-saving treatments? Health is not a privilege, it is a right. No Ghanaian should die because they can't afford care. Leadership must wake up, the government must act, and we, the people, must demand better. This is not just a health crisis, it's a crisis of conscience. Our leaders must remember that they are servants, not masters. They must prioritize our health, our lives, and our future. To the ordinary Ghanaian, your voice matters. Demand free dialysis. Demand affordable hepatitis treatment. Demand accountability. This is Gbugbuji for Chains Unbroken. Ghana, the choice is ours. Will we let this silent death sentence continue? Or will we rise and fight for a healthier, fairer nation? The time to act is now.